Approximately 1 in 1,500 women will be diagnosed with breast cancer while they're still in their 20s, and about 1 in 200 will be diagnosed while they're in their 30s. 9% of all breast cancer cases in the United States are diagnosed in women under the age of 45. So the American College of Obstetrics and Gynecology recommends that clinical breast exams start at the age of 25. So basically this means going to see your clinician and them performing a breast exam. When I do these, it's more than just me doing a breast exam. It's a time for education for the patient where I teach them how they can do their own self-breast exams, also being aware of other signs or symptoms such as skin changes that overlie the breast, dimpling, redness, or lumps in their armpit. This allows the patient to have what we call breast self-awareness, and if they have changes, they can always call our office, get in with us, and we can evaluate their concerns further. So women under the age of 40 typically have very dense breasts, which makes mammograms less accurate. It can generate what is called a false positive. A false positive is essentially when the imaging modality, like the mammogram that you're using, says that there's something wrong when there's indeed not something wrong. So we find that mammograms generate more false positives in women under the age of 40 than over. This can create a lot of stress, anxiety for the patient. And so this is one of the reasons why we don't just initiate mammograms, on everyone under the age of 40. There are some times where we may recommend that women start having some type of annual screening before the age of 40. Common reasons, maybe if you have a first degree relative, such as a mother or sister that had breast cancer, especially if they were diagnosed under the age of 50. Other reasons would be if you had someone in your family that was known to have a genetic mutation, such as BRCA or BRCA. If you have any of those concerning things, those are other reasons why you should talk to your healthcare provider and see if they may be an indication for you to start surveillance earlier. There are some genetic tests now where even if you haven't been diagnosed but you have a family history or a high risk, that those can be offered, and that can help stratify your risk even further on if you're a candidate for additional imaging. So if a woman has a specific breast concern, like they have a lump or they notice some skin changes, these are all reasons why they should definitely call their clinician, get in, be evaluated. And in these circumstances, we certainly will further evaluate their concerns. Women under the age of 30, we usually start with a breast ultrasound, as these are more sensitive than mammograms because of the dense breast tissue. After the age of 30, typically we do start with a mammogram. It does depend on a patient to patient, and sometimes we do have to have multiple imaging studies to fully evaluate the patient. These are considered diagnostic imaging, meaning that we're specifically looking for a concern that the patient or the physician has. So they're kind of separate from routine annual surveillance. After that is evaluated, your clinician will inform you of if you need to start on any type of annual study or if no additional testing is needed at that time. So I think it's important that regardless of a woman's risk factors, that they always remain vigilant. So breast health is part of your overall health. It's important to take care of your body. I recommend that women do perform their own self-breast exams. Typically, this is done the week after their menstrual period. This has become somewhat more of a controversial topic. I still think that it's very important for women to know their own body and be their own advocate. And if you have something that's concerning, certainly bring it to the attention of your physician or your healthcare provider. The first thing I would say is to know your family history. So ask your mom, ask your dad, know if anybody in your family, a grandma, an aunt, if anybody's had breast cancer, along with any other, past medical history. It's really important for your healthcare clinician to know your family history. The second thing I would say is take care of yourself. Be active, exercise, eat healthy foods. Third, I would say it's if you smoke, stop. If you haven't, it's not a good time to start. And fourth, there is some interesting things that we found is that women who have their first child prior to the age of 30, and especially those that breastfeed, are found to have a lower risk of breast cancer. When it comes to breast health, it's important to know your own body. And we talked about breast self-awareness as well as self-breast exams. If you have a concern, it's important to bring it to the attention of your clinician and feel that you're heard. So if you feel that you're not heard, I would see them again. And if you still don't feel that way, it's important to find a provider that does take your concern seriously and that you feel like that you have a good working relationship where you're heard and evaluated. My sister-in-law was diagnosed with breast cancer. She is an outstanding nurse, mother, and athlete. She had no genetic risk factors for breast cancer, no first-degree relatives that had breast cancer. She was very active and she didn't smoke. At the age of 29, she felt a lump in her armpit, which she brought to the attention of her healthcare provider. Initially, she was placed on antibiotics for this. Later on, she did her own self-breast exam at home, which she felt a lump in her breast. Initially, this led to the diagnosis of breast cancer. Unfortunately, at the age of 36, recently this year, she did pass away, leaving behind her husband and 3 amazing children. It's important that even if you feel that you're low risk, that you take care of your own self and know your own body. It's important also that you find a provider that makes you feel heard and takes your concerns seriously.